I am Sarina Logan, and I am in Napa, California. I have known Bonnie and Tony Adario practically my whole life. My parents were colleagues with them and did a monthly dinner with them, so they've known me since I was 3 years old. When Bonnie was diagnosed and she started the foundation, we immediately jumped on board to volunteer and help. So I've actually been involved with the foundation for years. When I was 38 years old, I all of a sudden started feeling a pain underneath my right rib cage. Didn't really think anything of it. Went to the doctor and they thought it was pneumonia. So they isolated me and did a biopsy. The biopsy came back as stage 3 adenocarcinoma. So the second person after I called my mom was Bonnie. I mean, the fact that Bonnie had this foundation and I coincidentally got lung cancer out of all the cancers. I mean, that's what we always say, like, out of all the cancers, I got this one. And I'm so lucky that I know Bonnie and Tony. It was important to me that I reach out to her because I was in shock. Even with the knowledge of working with the foundation and everything that they've done, it was never on my radar to have a diagnosis of lung cancer. So I ended up doing chemo and the cancer recurred. And when it recurred, I was stage 4, and they decided they needed to find something stronger for me that would work in a long-term position. And so they found a targeted therapy called Tagrisso, which is targeted for my biomarker, specifically exon 19 deletion, with minimal side effects. I think it's imperative that patients be their own best advocate. My doctor wanted me to do the chemo IV and to do radiation, and Bonnie said, ask if you can do Tagrisso. He took it to the tumor board and they agreed with her. And now I'm on a targeted therapy that put me into remission in 3 months. It's been awesome because I've been able to live my life. It really allows the functionality of a normal, my new normal. The side effects are there, but they're so minor compared to an IV chemo. I take it daily, I go to work. I mean, it's absurd how amazing this medication is for me. Being a newly diagnosed cancer patient is frightening, and the Go-To Foundation has provided me with so much structure, and I feel like your best opportunity as a newly diagnosed patient is to ask as many questions as you can. The Go-To Foundation has made an impact on my cancer journey in the fact that they have provided me with so many resources. The living room, which featured my doctor, Dr. Gandara, and the handbook that is provided just to get you through those basic aspects of dealing with a lung cancer diagnosis. It's been tremendously helpful for my journey. To Bonnie, Tony, and the entire Go-To Foundation, I cannot thank you enough for everything that you have done, not just for myself as a stage 4 cancer patient, but for anyone who is trying to learn more about it, my family included. It's such a daunting thing to deal with, and without the Go-To Foundation, I would be lost.